Most of the presentations to the gynecological clinic comes with pain, and the reason for surgical intervention is to address pain. Second is abnormal uterine bleeding. Of course, there are other indications, but with pain in the remit of benign gynecology, we have conditions like adenomyosis, which is an increase in the size of the uterus, also contributing to the more bleeding. And also we have endometriosis. So the patient most likely will come with one of those conditions, and that will lead to some sort of investigation. In some proportion of cases, the most efficient way to treat it by hysterectomy, and that can be achieved nowadays as minimal access surgery. Now, surgery in general evolved. So if you get a book written in 1964, like my dad was a doctor, this doesn't apply because all the surgical techniques have evolved with the improvement of anesthesia, with the improvement of the approach to the patient. Now surgery is less traumatic. It's done as minimal access surgery. The patient recovers fast, and also there is a tendency to resume the patient functionality as soon as possible. The techniques, basically, with the advent of the laparoscopy, the adoption of minimal access surgery, is now done through small wounds, as cosmetic, and also the operation is done technically in a very delicate way. The ultimate result will be a patient who is less pain, with less pain medication required, and also with early return to function. So with the advance of minimal access surgery, there is also an advancement in how to think of the wound. There are many ways of doing that. One way is to use one incision surgery, and this is called single port or single incision laparoscopic surgery. This involves a small incision or cut in the belly button. That through it we can put instruments to do what we need to do, like removal of cyst or remove uterus. It can also work for ectopics in emergency settings. This is one way of doing it. The other way is to do V-node surgery, which is using the vagina as the access to do the procedure. And this is truly scarless surgery. Through this technique, it's a combination of vaginal approach and laparoscopy together, where you can start with the vaginal approach and then put instruments to allow you to do a precise job using the precision of the laparoscope and finish vaginally, so the patient have no scar. This technique now is established, is not new. It is a good option for patients for many conditions. So with regard to the single port surgery, for the patient, it's cosmetic, so it have one incision, and if you have one incision, we have to say you have less pain. And also from the functionality point of the surgery is that this incision allows you to do a lot, like removal of a big cyst, rather than to have an additional cut to do that. With regard to the V-node surgery, studies show that it has, in comparison for laparoscopic approach, it causes less pain and also needs less time. It also has less complication and allows the patient to be more functional and return to function early. The technique is gentle on the system. It's less traumatic. For the anesthesia part, it's also make the patient much more physiologically safer, because you don't need a lot of head down, you don't need a lot of intra-abdominal pressure. In that regard, this technique is least traumatic to the patient. With regard to the risks, as with any surgery, there are risks. The risk of single port surgery, the umbilicus can change shape. There are small risk of wound infection. very, very small risk of hernia. However, this technique is practiced with the aim to reinforce any layers you go through. With regard to the V-knots technique, there is a risk of bladder injury, risk of bleeding, infection, return to theater, risk of conversion to to laparoscopy or open surgery if required. However, the efficacy of the technique is very high. In well-vetted selected cases, the efficacy can be as high as 98%. So it needs training, settings, ergonomics, and a system to care for the patient from the start. So with regard to single port surgery, the recovery is depends on the operation. For example, if you do a nexal surgery with basically removal of a cyst, then the operation is similar to laparoscopic surgery. You need 2 weeks before you get back to 90% of your function. Hysterectomy, we say again 4 weeks before you get back to majority of your function. The aftercare, people may experience some pain around the umbilicus, which is the belly button, similar to when they've been to the gym or exercised a lot. This can carry on for a week or two. With regard to the V-knot surgery, the recovery is even much more efficient. Majority of patients don't report pain after 2 to 3 days, as if they didn't have an operation. However, they need to treat that as a major operation if they had V-knot hysterectomy. I would say 4 weeks before driving, 4 weeks before they get back to work. If they are keen on sport activities, I would say swimming needs to be delayed to 2 months, and as well as gym activity, but they can do walking, they can do cardio after 4 weeks. My experience with patients, they love this technique and they actually prefer it over other techniques because of this application to their life. And majority of people, they want an easier recovery and less painful procedure.
Good. Would there be anything else to add with regards to other techniques? Anything else?
Of course, the technique will require, any technique will require proper preoperative assessment and care and evaluation, assessing the size of the target you want to address, assessing the patient, listening to the patient perspective, what they expect, what's their network of safety when they go home. Of course, it will be very important to also reassure the patient that the consent process is dynamic if they want to change their mind. Also, after they had the operation, they need to be reassured that there's a system they can contact if there is any deviation from the normal course of recovery. And also, we are keen personally on getting patient outcome measures. And this is very important for any surgeon to get their outcomes measured and also listen to the patients.